You're watching CTOM TV. Knowledge is power.
Is there help for chronic leukemia?
Yeah, there's been a lot of advances in CLL over the last few years. I'm assuming it's CML is what she's referring to.
You said CLL at
CLL,
first.
so it's chronic lymphocytic leukemia. Yeah, I'm assuming she's referring to CML. It's hard to say. I guess that's going to be a defining factor. What type of chronic? One of the main drugs that's used is rituximab. That's a CD20 targeting agent. There's a bunch of new advanced treatments. Alemtuzumab, a CD52 antigen targeting agent. Ofatumumab is working really well. That's like a second or third generation version of rituximab. Also targets CD20. Obinutuzumab, that's also getting some great results. And that has a slightly different mechanism for targeting CD20. It kind of overlaps rituximab, and so it covers part of what rituximab is doing and also covers a different area of the binding pocket. So it can be quite effective in patients that haven't stopped responding to rituximab. Then there's Bruton kinase inhibitors, such as ibrutinib. They work very well. Idelalisib, PI3K delta inhibitor, if you have mutations in that area. And then venetoclax, which is a BCL2 inhibitor. That's quite beneficial too. So there's many different combinations. Once again, you want to get genetic testing to find out which one of these amazing new agents is going to benefit you.
And those what you just mentioned were for CLL?
CML.
CML,
Yes.
Okay. Now, just out of curiosity, because that's the way my brain works, why did you choose to answer that question for CML?
I'm assuming that's what she means.
Okay, and why would you assume that?
It's more common.
Okay.
Cancer, there's a video on CML, advances in CML, on the Cancer Guide website too.
Okay.
So that would be something I'd look up. You could read more in detail about these. But the bottom line is most of these drugs do apply across the different leukemias and lymphomas and so on, depending on what the molecular targets are.
Okay. Oh, right. Back to that old thing again.
Yes.
Right. Because I was listening to you talk about certain of those pathways that some of those drugs might target. And I thought, well, how would she know?
Exactly.
And it's because we would do this genetic testing. Right. So I guess the first question, Betty, well, the answer is yes, there is help for chronic leukemia. The first question back to you is what kind of diagnostics have been used so far? Was there any tumor DNA sequencing?
Yeah. And what was the pathology too?
And what was a pathology? Those would be two important bits of
Very
detail.
important.
And then you could have potentially a far more effective treatment.
Thank you for watching CTOM TV. Subscribe below and stay informed.